All right, we're back on Sports Plus, and I'm joined by Dr. Gattasali at the Healthy Heart Center here in Odessa. And, I'm really excited to get checked out today because, you never know, something could be wrong. I should say excited, but also nervous.
Paul, welcome to Odessa, first of all.
Thank you. Glad
Yeah,
to be
we
here.
have a state-of-the-art clinic
Mhm.
here that we can help you and we can investigate, what problem potentially you could have. So once again, welcome.
Great. Yeah, happy to be here. Now, what exactly are we going to go through? Because I think some of the guys on the crew were messing with me when they were talking about different probes and things like that. It's not really that invasive, right?
No, it's not. Initially, when somebody comes in for an evaluation by a cardiologist, they typically have some concern, or they may have a symptom such as chest discomfort, chest pain, shortness of breath. They probably feel fatigued, they may be lightheaded, or they can feel their heart beating. And they may have certain risk factors. People in the family may have had a heart attack or a stroke or needed bypass surgery. So they would have all of these fears in their mind, and then they would come to see a cardiologist. Typically, they could be referred by another physician who's already seen them and has a suspicion for having heart trouble. So when somebody comes in, we tend to first calm them down, reassure them that things are not invasive all the time. We do what is called a history and physical. We meet the person. We're going to call them a patient at this time since they've come in, and at that point do a careful history, finding out what their problem is, when did it start, what's going on, what are the fears in their mind. Then do what we call a risk assessment profile, and then run a basic examination of the heart and the blood vessels that we can, amongst other things. Use a stethoscope to listen to their chest, and do a simple EKG. That would be the first step.
So would you say most people come in here for preventative care or when something's wrong?
A majority of the people see a cardiologist when they have a symptom. A minority, a few people do come in for preventive care, especially if they have high cholesterol or things of that nature.
Okay, and so I'm going to go through all these tests. Now I'm just kind of wondering what it's going to look like. Am I going to be in some backless gown? Is this going to be kind of horrifying in a sense, or?
Absolutely not, Paul.
Okay, it's nothing to worry about, right?
Nothing to worry
Okay,
about.
great.
Your dignity will be maintained, and we'll just, you'll of course have to get your coat and your shirt off for us to apply the electrodes to do the EKG, and we might be doing an echocardiogram, which is a sonogram of your heart. It'll look at your cardiac chambers. We'll look at the valves of your heart. We'll look to see, how your heart muscle is moving if you need that test. And then, if you do have an indication and you need to have a stress test, we'll be putting you on a treadmill. But again, no backless hospital gowns.
Well, that's really, really reassuring to know. Now, it's really neat to think about a heart sonogram. Are you still fascinated to this day, just watching the human heart beat as it does?
Oh, absolutely. It just is really fascinating and provides a tremendous amount of information to a cardiologist. So it's one of our vital tools that we use, to measure the dimensions of the heart. And then if somebody has had heart trouble, we measure the strength of the heart fairly routinely, and that helps us guide our treatment long term.
Now, I know exactly the moment when I got into what I'm doing now, and when I knew that's what I wanted to do. What was that moment for you when you knew that you wanted to be a doctor, or more specifically, a cardiologist?
Well, I trained in Wisconsin. This was in the late 1980s. And at that time, the heart surgeons were doing a lot, but there was a new breakthrough in cardiology. And I trained in a very powerful cardiology program in Milwaukee. And then I met, a gentleman who was going to be my mentor. And he was bringing lots of new things that could be done without surgery. So when I saw him do some of these procedures on patients who were, having a heart attack, that was, I was fascinated that, this could work out long term. And so that's what got me into cardiology, because that was where I could go with new, sophisticated technology and to help people, who are really having a heart attack, or to help them avoid heart bypass surgery.
And how did you end up in Midland, Odessa?
After I finished training in Wisconsin, I wanted to come to a little smaller town, and Midland, Odessa met our characteristics of what we were looking for, and I was recruited by the people here in Odessa.
Oh, that's great. Well, you also have done a lot of good for the community. I know that you help out a lot of people in the surrounding areas as well, right?
Yes, we do have outreach clinics here in West Texas. The distances are quite a bit, far away. People have a hard time driving, especially if you're an elderly person. And some people have limited finances, they can't come 150 miles. So once a month I go to 6 different towns in West Texas, do consultations, see patients there, and only bring them to Odessa if they need any sophisticated treatments or investigations that are not available in their towns.
Good. So for those watching out there, what are the signs they need to look for when they know that they need to come and see you?
Well, typically, to see a cardiologist, one should probably see their primary doctor with symptoms, and the primary doctor would potentially refer them for symptoms such as chest discomfort, chest pain, shortness of breath, palpitations, lightheadedness, fainting, unexplained fatigue, rapid heartbeat. These would probably, sometimes people can have swelling in their legs that could, potentially indicate a condition called congestive heart failure. So for all of these would be most common areas for people to see a cardiologist.
Okay, great. Well, let's go through some of those tests and see how I do.
Okay.
Okay, so we've gone through all the tests now. How did it go, in your opinion?
Paul, I think you did really well. We did do the stress test, and I'm glad to say you did well on it.
Great.
So after all the testing, my recommendations to you are to continue a healthy lifestyle. If you can implement some amount of exercise in your busy schedule, that would be good. And if you can moderate cholesterol intake if you can moderate your cholesterol intake if your cholesterol is high,
Okay.
by a low-fat diet, these are the 2 things I would recommend for you.
Cut out the energy drinks, right?
Cut out the energy drinks. Yeah, anything in moderation is good.
So to find out more about Dr. Gadasali and the Healthy Heart Center, where can we find more information?
You can go on the web, on the internet, and look at healthyheartcenter.net, and also facebook.com/healthyheartcenter.
I'm going to go like it right now. Stay tuned for more next.